Well, thank you first of all to Christopher and Andy for joining us. And this is something we'll touch on, of course, during the conversation. But I'm sure for both of you guys, an incredibly hectic time for many reasons. What we used to do was we normally do a quick introduction ourselves, but I always think it's actually better to hear from you guys, the speakers. So I'll pass over to you guys, and we'll pass over to Andrew first of all, and then on to Christopher, and let you guys give a quick intro to yourselves, and then we'll get started on the panel discussion and take it from there.
No problem at all. Hi, my name's Andrew Parfery. I'm the CEO of CareSourcer. We've been going for 3 years. Prior to CareSourcer, I actually used to run our family's home care business. So had I still been doing that just now, we'd have been helping carers go to clients, look after them through this crisis. So I'm very pleased I'm not, for obvious reasons. We as a company have a marketplace much akin to Rightmove or Zoopla, but to help people find care. And our mission as a company is to fix what we see as the broken care market, a really difficult process to find care and a highly fragmented supply side that you need to connect with to find that care. So we are 25 people as a company. We're based in Codebase. And during COVID-19, we've been doing lots of work, particularly trying to help the public sector understand what providers have availability so that they can, for instance, discharge people from hospital more quickly than they could otherwise. So that's a short intro from me.
Hey everyone, my name is Chris McCann. I'm CEO and co-founder of Current Health. We bring together continuous monitoring of health with analytics to try and identify the onset of disease, and then video calls between that patient and their healthcare team in order that they can intervene early and hopefully stop that patient deteriorating and keep them at home. We mainly focus on patients at home, either accelerating their discharge from hospital or avoiding them ever being admitted in the first place. But we also do a bit of work on the inpatient side, and we do a little bit of work now in the nursing home and social care side as well. And our focus is really to help bring preventive, proactive care to the patient, so treat them much earlier than would otherwise have been possible. And specifically during the COVID-19 outbreak, helping do COVID-19 detection of patients who are high risk in their own home, or do COVID-19 detection in nursing homes and inpatient facilities to reduce exposure of healthcare staff, and ultimately try and increase overall capacity within the system. We're about 40 people, most based in Edinburgh, but we've got a growing team in Boston, growing quite a bit right now, hiring about another 25 people at the moment. Our business has grown quite significantly as a result of COVID, and we don't see that ending anytime soon. And nice to be with you all, albeit under slightly strange circumstances.
Absolutely, and the certain strange circumstances will be, of course, touched on later. So thank you guys for the introduction, and I'm really excited for the talk in many fronts. One of the things that I'm really keen to delve into, and I'll let you guys get your thoughts on this as well to begin with, is, of course, you guys come from very different backgrounds in terms of the career and education aspect. Of course, for you, Chris, it's more education-based in terms of computer science and obviously medicine. And Andrew, of course, with marketing and sales experience, and obviously, like you mentioned, with specific experience in the care industry. One thing I'm always keen to ask and really get the story behind is your passion for entrepreneurship and starting companies and solving problems. So first question for both of you guys would be, was there a particular moment this started, or is this something that's developed throughout your career? And I'll let Chris go first for this one, and Andrew as well afterwards.
Yeah, so I think I always had an interest in starting a company. I think partly that's my uncle started a company when I was pretty young, and it grew to 500 people when he eventually sold it, and I was very young and kind of in and amongst the frenetic activity that went into building that company, and I think it was something that really interested me. And then specifically the moment for Current Health came when I was a med student in Dundee. I was on a placement at the time within the intensive care unit in Ninewells, and we kept getting referred patients who had gotten sicker on the general wards of the hospital, and it's because the ability to monitor those patients and identify when they're deteriorating is actually pretty poor. We're super reliant on nursing staff going around the ward every like 8-12 hours, and that problem's just exponentially worse in the home. So I thought, hey, this is kind of crazy, why don't we solve it? And thought, hey, this is going to be easy to solve, and it turns out it's actually pretty hard.
Yeah, mine is a bit similar to Chris's, and there's some crazy stat along the lines of you're more likely to start your own business if your mother or father has had their own business than not start your own business. And my dad left school, no qualifications, became a social worker, saw the care in the community. This was before a regulator existed, and decided he could do better. And so he set up his own home care company, and 20 years later, I took that over. But again, from being in amongst it from an early age, I remember mum and dad, before computers existed, working out how they were going to pay people at the kitchen table, going to an office, it not working out, coming back to the kitchen table and then starting again. So I got the bug from that. I remember I would go to the shop with my pocket money, buy some sweets, and then come home and try and sell it at a profit to my brother and sister. So I think there's something in being in and around it that gives you, I don't know, maybe the confidence or the desire to do it yourself sometimes. So when my dad became unwell, I actually worked for an FMCG company in sales and marketing before taking over the family home care business. So when he became unwell, I came back home and took it over, and it was a baptism of fire because I was used to things being organized and structured as you do in big corporates, and this was far from it. But a baptism of fire that made me investigate what the problems were in the sector, and came to the conclusion that with my co-founder, who was running another home care company, that the sector is broken. There is not enough money in the system. Care workers are on 0-hour contracts. It's highly fragmented on both supply and demand side. And actually, with technology now, there can be a different way. We can connect people directly to providers in real time, help them find care quicker, and deliver an online solution that's been done in many other sectors like flights and hotels and property, etc.
That's it. It's great to hear that, actually, and it's great to have that link actually between both of you, obviously with family connection and entrepreneurship. And I think what's really good and what you both touched on, which I think is a real important area, is solving a problem specifically. Obviously, both there's a certain degree of interconnectedness and individual issues. One question that I'm really fascinated by, it'd be great to get your thoughts on this, is with entrepreneurship, of course, and especially in these, I was going to not say unprecedented, but I'll use the cliche, unprecedented times. There's no guarantees. Entrepreneurship by nature is risky. What's your take on entrepreneurs having backup plans? And this could either be by working on the startup part-time and having a guaranteed income alongside it, or potentially working full-time with a backup plan in place afterwards. What's your take on it? Start off, Andrew, I guess, for this one.
So it depends what kind of business you want to build. Are you looking for a lifestyle business that grows organically over time, or are you looking to raise capital to grow a big business? And look, it's not possible for everybody, but wherever you have the opportunity, putting your entire mind, body, and soul into the project is the best thing to give it the best chance of success. Also, if you're not going to do that, you're unlikely to attract any investment, because investors are looking for you to be there 120%. So it's difficult. I've known a lot of people who have started companies and they've held on to their day job because there's practical reasons for needing to do that. You've got a mortgage or rent to still pay. But at some point, most people find you've got to put it all on the line. Because while you're not putting 100% into something, there'll be somebody else or 10 other people that are, and they're more likely to achieve it in advance of you. And if first mover advantage is important, then that can be critical.
Yeah, so I agree with Andrew. I think it's a really difficult one, and it's really difficult with this topic not to stray into like the subject of privilege and inclusion, because I was really lucky that I could effectively put my medical degree on hold and put, all of my time and effort into this company, because I had the personal means to do that. And not everyone has the means to do that. And I think that makes it, that makes this conversation more difficult. I 100% agree with Andrew that whether or not it's right or wrong, the practical reality is you're very unlikely to raise particularly substantial investment unless you demonstrate your ability to put your heart and soul into it. And that's just a pragmatic point. I also, just practically speaking for me, there's absolutely no way. I struggle to maintain a personal life doing this, never mind maintaining any other interests. That all being said, I think it very much, and Andrew touched on this as well, it depends on what you're trying to build. And I think too often there's these kind of generic pieces of advice thrown out which don't take into account individual context of what type of business you're trying to build and what your aspirations are and ambitions are. And it's not everyone wants to build a multi-billion-dollar company, and that's completely fine. Depending on which path you choose, there are potentially other ways of doing things. But I would agree with Andrew's closing point. It's very difficult, especially building something high growth, to not have to put everything on the line at some point.
So yeah, it's a brilliant point from both, and of course investment is something we'll touch on later on, and be really keen to get your insights, especially from a Series A perspective with the last couple of years. One thing, I guess, going back to the early days as well, and thinking about, it's exactly what you've said, where you're going all in and having that early momentum. Naturally, an important part of this, at least for many businesses, is co-founder. And one thing I was super keen to delve into is how did you naturally find that dynamic with your co-founder in the early days in terms of balancing your skill set, and what best piece of advice would you have for any entrepreneurs in finding a co-founder? What are the things to look out for? What are the things to be aware of in terms of your own skill set and potentially blind spots, if that's applicable? And we'll go back to Chris. We'll alternate it, I guess, for the questions.
So I think my general position on everything is that there are no rules. Like, I know that there's kind of established advice about how the best founding teams are created and at what age you should start companies and all this kind of nonsense. But from my point of view, there's no real rules. So, Stuart, I didn't know in advance of this. He got in touch with me because he heard about what I was doing. Stuart was a very, very good and remains a very good complementary partner to me, in that he is technically the smartest person that I've ever met in my entire life, and he was someone that I could, despite the fact he's the most frustrating person I've ever met in my life, someone that I could really rely on, and is a very, very, very good friend now. But we didn't know each other in advance of this at all, and we've developed that relationship through the course of doing this, which presents its own challenges and obstacles, in lots of different ways. But my point of this story is that I 100% do believe it is too much work for one person, and it's not just about the day-to-day list of tasks. It's also just the mental and emotional challenges of doing this. I actually think that the hardest part of building the company is not the amount of work to be done, it's the mental and emotional impact and the uncertainty. And having someone that you can be completely honest with and discuss that with is really important in my view. And I was lucky to have that in Stuart. But you know, as I say, we didn't know each other before this. I just was talking about what I was doing, and he reached out, and it went from there.
Yeah, I ran a business before where I didn't have a co-founder, and having a co-founder for me has been so much more satisfying and also easier. Satisfying because you've got someone to share the highs with. Easier because, to Chris's point, if things are going good or bad in work or outside of work, you've got somebody that you tell everything to, and they're there to support you. But I wouldn't do another business without a co-founder. That's probably how strongly I feel about it. Andrew, this is my co-founder, another Andrew. We don't look the same though. He's like Rodney, tall, thin, and I'm like Del Boy, short and fat. So just to give you a visual picture. But he, again, does things that are not natural to me. So he definitely has a vision and is able to cut through all the noise and all the information and provide direction. And that's really helpful, while I'll spend more time thinking about how we execute and thinking about the detail. So complementary skills are really important, but I would be that strong as to say I wouldn't do another business without a co-founder. That's how much more enjoyable and helpful it's been for me second time around.
Fantastic. And again, great to have such a similar point. And it's a really important theme, I think, and it's something that I'll touch on at the end, actually coming back to the mental well-being and potentially the hustle culture, which I know is dying out potentially a bit now. Thinking of support, actually, one thing that might potentially be useful for the audience today is where to find support, where are the best avenues to look, especially in the early days. And touching on, I know you both entered Scottish Edge and the Future at Silicon Valley Scale program as well is great examples, which I've heard very positive things about. Where would you recommend for somebody starting out and they've got a co-founder and they're still in the very early stages? Where are the best places to find support?
Oh, I've found build your network with other founders of startups. And, you know, include within that some people that are a bit further ahead in the stage and some people that are at the same stage as you. But without a doubt, unequivocally, I've had the best advice and support from the founders of other startups. They understand where you are. You can ask really confidential questions to them and get great answers if you've got that trust and that relationship. So with that in mind, one of the things that's been most helpful for me has been the Scale Up Scotland program. There's about 20 scale-ups that are on it. We came together every couple of months for 18 months. We've got a WhatsApp group, and you name it, if you've got a problem, 3 other people have got the same problem or have been through it and can give some great advice. So I would start there. I wouldn't go to necessarily without first of all having that. The obvious maybe places like, for instance, other veterans in the industry or people that have held big jobs at big companies. For me, that's good and it's supplementary, but you need people who understand the stage of your company and who can talk to you founder to founder.
I feel like I'm just going to keep saying I agree with Andrew. I particularly enjoyed Andrew trying to delicately stray a line there around not criticising other people in Scotland, which I completely agree with. So definitely, it's really hard to express how different this stage of company is to a company that's 200 people, 500 people, 1,000 people, 2,000 people. Like someone who currently runs a company that is successful and profitable at 2,000 people, you know, yes, there are no doubt things that you can learn there, but their experience will be very different to the one that you are going through at present. And so I solidly agree with Andrew's point on other startup founders, particularly those who are a couple of steps ahead of you are like critical. and don't just jump for, I'm trying to stray the line, don't jump for the obvious people that are sometimes recommended in Scotland, because big companies do not necessarily have any, in fact, they don't have any comprehension of what it is that you're going through. The other thing I would say is try not to just stay within Scotland for that advice. Scotland's great, it's got a close-knit community, but its experience, in my view, is a little bit one-dimensional. There aren't that many very successful technology companies in Scotland, so therefore the experience and expertise, in my view, is the sample size is limited. And I would really encourage people to go beyond Scotland and meet founders who come from London or Europe or America, people who are going through other things and who might have different perspectives on growing companies, and different attitudes on growing companies. I would really encourage people to find advice and expertise just out with the kind of local community.
That's such a great point, Chris, and it's something that I guess we're a bit guilty of potentially as a ecosystem in Scotland, to a certain extent, of being a bit limited to a fair degree. And one thing, I guess, going back to the stage that you're both at with the size of the company and even, I guess, product development to an extent as well. One thing, and maybe this is specific potentially to the industry, how have you find that balance of developing your products in an industry where it's so important to get it right? There's such high stakes in both points. People are coming to you as a business to solve a problem that has huge repercussions. How have you found the process of building the product, getting feedback, and continuing to build the products? I'll come back to Chris for this one. Yeah, come back to you, Chris.
So for us, we see the product as the entire end-to-end experience. So from the minute our prospect engages with us as a sales prospect, through to the implementation and training process, through to the bit where we deliver kit to them, through to their use of that kit day to day, and in the ongoing engagement they would have with our customer success team. So we consider the whole thing as one end-to-end product. And then I think we get a huge amount of feedback on a daily basis. We're up to about 35 customers just now, and each of them has a team of about 150 who will engage with our product on a day-to-day basis. And most of them are fairly opinionated about what they think, and sometimes the incentives are very different. Our customers are quite complicated in that we have nurses touching our product, doctors touching our product, executives touching it, patients touching it, and all of them have slightly different interests in what they want from that product. And we have to try and pass through that and deliver the best experience we can for the frontline nurse and doctor and patient, whilst also delivering an economic value proposition for the executive. And sometimes those things are in tension. What we try and do, and what we've been successful doing so far, is very closely aligning our product team to our frontline users. And we're quite privileged in the healthcare space, and that it's unusual for companies to do this. So to use a very specific example from a call I was on today with some of our frontline users in our product team, one of the lead nurses on that call was like, I've never been asked in my entire 20-year career what I think about the product and how an improvement can be made, which is quite staggering. And the improvements she suggested validated some others that we'd had. It's now at the top of our roadmap. We'll ship it within the next week or so, and we'll show her the work that we've done. And for me, that creates quite a lot of user loyalty and love. And it also kind of generates tolerance of the things that we don't do as well as we should, that we need to catch up on. But it does also take a kind of constant daily process of what is the biggest priority, why are we doing this? And that isn't something we always get right. And we've had to learn a lot on, around building things that we shouldn't have built, building them not in the right way. But most things are reversible. You can get it wrong and then you can just rip it out and start again. That's apart from the hardware, that's the beauty of software.
Yeah, I don't have too much to add on this. Chris's product is far more there's far more grave implications of if something goes wrong there than our product, as an example. I would echo the point though on being customer obsessed and getting feedback from them at every stage. The end user are absolutely brilliant. That's what we've got a lot of value out of as well. I guess the only other thing I would say is that because we're a marketplace, we put some controls in place. So we said only regulated providers could come onto our site, not introductory agencies or self-employed care workers, as an example. We made a conscious effort there. We also try and, because we've got a community of people looking for care and providers interacting, we also play a moderator role with that community. So if we see, for instance, somebody looking for care who's communicating in a particularly offensive or bad way, equally the provider not being responsive to the people that are looking for care, then we'll, in the right way, interject and say, look, here are the community rules. It's important that you do X, Y, and Z so that everyone gets a good experience from the site and fulfills the jobs that they're trying to do. But we don't have too much in terms of someone's health that could go wrong, thankfully, from the product that we've got. It's one of the reasons why I sleep much better at night now than I did when I had a home care company, when we were delivering about 1 million care at home visits a year, and any one of those visits could have had catastrophic outcomes for people if the visit hadn't gone well.
That's it. Thank you, Bob. And such good points on it's interesting. I think one thing I'm really keen to get, and I'll ask this in the next question, is especially with both actually, there's so many stakeholders, and I guess for you, Andrew, with CareSource, potentially the relatives coming into play has been key influences of decision making, and of course Chris with the health hospital specific side of things. One thing before I do forget, with Slido, we do have the option for you guys, everyone watching, to submit your questions for the end. I had a great suggestion during the breakout rooms actually, which I've added in, and I'll be asking at the end. So get those questions in, guys, and we'll get those at the end as well. And one thing that you mentioned as well, Andrew, which ties in really nicely with marketing actually, has been customer obsessed and getting feedback and really finding the pain points and everything else. How have you approached marketing in this industry? So I guess to a certain degree, there's so many stakeholders and decision makers and different influences. And I guess, Chris, for you, obviously, this potentially comes back to the other side of it from a healthcare point of view, especially having best from your medicine experience. Of course, Andy, with your marketing experience before taking over your care business.
I think one of the key things is don't try and boil the ocean. So don't try and market to everybody day one. Pick the beachhead, the target segment that you want to sell to first. Be very considerate of the first interaction or their first awareness of you at the start of your product experience, as Chris mentioned. And make sure you're obvious about the need that you can solve for that individual. It's kind of as simple as that. When I think about the public sector, though, I'd really like to hear what Chris has got to say, because my view has been that and we've tried this and it has not been extremely successful, but trying to sell technology or frankly anything to the public sector, we've christened the graveyard of startups in the UK, because there's so many decision makers. You've got 200 local authorities, 127 trusts, a bunch of other quangos in there as well. They hate change and they've got very little money to affect a change as well. So you'd have to go door to door around the UK to get scale adoption of something like what we're doing. And as a startup, you don't have time to do that. So I think really smart move from Chris's perspective was going out to the States. I'm sure there are other reasons for that as well, but you've got a far more privatized healthcare market out there, which lends itself to work with the private sector better. That's just been my personal experience.
Yeah, so firstly, don't sell into healthcare and public sector. Like, just don't do it. Start a different business. I, so we've learned a lot, and our view has shifted a lot. Um, we're in the kind of the difficult position that we sell to large enterprises, mainly in both the UK and US. And the expectation of large enterprises, and I'm saying large enterprises, I'm talking about large NHS trusts, clinical commissioning groups, health boards, American hospital systems. You know, their expectations are extremely high in terms of maturity. You know, they do not care. In fact, it is a disadvantage that you're a startup. So you're almost having to try and to distance yourself from the idea that you are small, and provide a service and product that is on par with very, very large organizations who've had the last 20 years to mature their products. So the barriers to entry are high, much higher than I ever understood them to be. That being said, there are some significant advantages that we have found we can achieve. So the first and most important is the ability to move at speed and create the impression of innovation. And I say create the impression of it because, particularly in the United States, innovation is in itself a value proposition. So one of the kind of curious things about the American healthcare market, which does not manifest itself as much in the UK market, is they're fiercely competitive with each other. So to give a specific example of this, and without naming any names, a couple of weeks ago, we announced a new client in an American state. Week after that, the other three major healthcare providers in that state all reached out and said, why are we not looking at your product? And suddenly they're all in funnel. And that's interesting. In the UK, one of the things that we see is there's a huge amount of virality between the NHS trusts. So there's a lot more collaboration and a lot more shared learning, which is both a blessing and a curse. It means your mistakes or failures are very quickly shared, which means you have to try and perform 100% of the time, all the time, or you can expect that your whole market will know about it. But any successes and any advocates you get in your market can very quickly generate more leads for you. So we do almost no marketing in the UK at all. We just rely on word of mouth among the NHS trusts. And one of the interesting things that we found is at this present moment, we are growing at equal rates in both the UK and US markets, which we did not expect. And is what Andrew alluded to around the US market. Our view was we would grow much faster in the US and much slower in the UK, and that's not what we found. And partly that's about circumstance. We have been lucky at the timing of when we've done things, not just from a COVID perspective, but because of a more broad focus from government on delivering more care at home. But the biggest things we've learned, to sum up, I suppose, is identifying very clearly who the buyer is within the organization, and being very, very stubborn in reaching out to them. I mean, like, it will take us 10 to 15 touches before we'll get our buyer to even respond to us. And our sales cycles can be anywhere between 9 and 12 months, although right now we're seeing that compress significantly. So there has to be a huge amount of tenacity in getting in front of that buyer.
Fantastic. And some great points that you both touched on. And I think this leads us really nicely actually into, I know something, Andrew, that you're keen to touch on with tech adoption actually. And of course, COVID's continually developing outbreak and situation, and it can be hard to potentially look at positives. But one thing, it'd be great to get your thoughts on as a wider, potentially bird's eye view on tech adoption. So of course, Chris, you made such a great point about how, especially in the UK with NHS, it's just so many decision makers and 9 to 12 month sales cycle, and same for yourself, Andrew, as well. It'd be great to get your thoughts on that. How could COVID-19 actually potentially speed up the process? And we'll come back to you, Andrew, for this one.
Obviously, it depends what it is that your technology is and whether it's it's going to get rocket fuel from this or not. But one of our shared investors actually was saying to me the other day that they've got an investment in a company called Push Doctor, which is obviously a GP service on your phone, and they've said that they've seen their market rush to them of what they were expecting 5 years to take in a matter of months. So I think that if you've got a bit of technology that is aligned to macro trends before COVID-19, then it might be that COVID-19 speeds it up, which could be really good news for startups that have got a limited runway or they're looking to raise more capital. There's a company in Glasgow that I know, and they're in sort of the health and care space, and they're going great guns because what they can offer is perfect for people stuck at home. So I think it can really accelerate it. I think the other thing, the thing that's tough is to know what behaviors are going to are going to stay different, and what are just going to go back to what they were in 12 months' time. That's one of the things we are trying to assess at the moment. What opportunities that look good now might not be in 12 months' time, because if you put your time and effort into something for the short term, but it's not building your company in the longer term, then you can waste a ton of time and effort. So being really clear about not going after short-term opportunities that won't serve your strategy and your long-term direction of travel is equally important.
Yeah, I totally agree. I think so. Our internal view on COVID, and I suppose this will stray a wee bit into more our view of the direction of the disease. But I think governments have been very successful, and partly because of the consent of the public, in bending the curve, as it were, and reducing the immediate impact of this disease. But this disease is not gone. It's only the curve is only compressed because of the unprecedented measures that have been put in place to control the spread of the disease. And there was a report out today in Germany showing that already, as a result of loosening the restrictions, the rate of infection has increased again. And it'll be interesting to see how that develops. What we expect is this will be part of life for at least the next 18 months at a minimum. And whilst 6 weeks ago we saw this incredible spike in action by providers in both countries. I mean, sales cycles for us went from 9 months to 2 days. Deals were signed literally overnight from initial entry to funnel, through contract negotiation, and to we're shipping kit to you within 24 hours, which is just insane. And it's actually quite refreshing, and it gives me some confidence in society that when government and public sector organisations really put their mind to it, nothing is unachievable. Decisions that would take months, I'm finding, have been taken in days, which is amazing. What we're also finding now that we're going out of the kind of initial panic phase, there is a view from our client group and the prospects that we're engaging with that remote care, virtual care, home-based care, whatever you want to call it, is a continuing strategic priority. We would find most of them would have identified it as a strategic priority last year, but not at top of mind. Now we're suddenly finding it's top of mind because it's a way to increase capacity within the hospital and prepare themselves for any second, third and fourth waves from the disease. So we have found ourselves well positioned in the market, and I don't want to use the phrase luck because it's a horrendous disease, but from our perspective, we were well positioned for this, and we've been able to ride quite an incredible wave that we don't see changing anytime soon, because it's crystallized in the minds of our customer that they're going to have to keep getting more patients out of the hospital into the home, and that's what we help them do.
Yeah, see, it's interesting because the government's not going to have any money, neither are local authorities after this for a long time. So if, for instance, you have a piece of technology that can save money, and by the way, that money saved can't just be spent again on the change process. Even with the change process, if it still saves money, then you're in a really good position. I do. We saw the trends before COVID-19 that care was happening more remotely in people's own homes. The truth is that this is my perspective, that there's far more care that could be given to people in their own homes. Chris's product is a perfect example of that. And there's no need for this £1 billion a year cost the NHS because of delayed discharges. We're proof that you can get a care provider in a matter of hours rather than waiting for weeks or months, as most people were experiencing in hospital. So what I think might be quite interesting next is, how can you dovetail technologies to add fuel to this? So for instance, let's say you had a platform that enabled you to have a wearable or a remote sensor so you could stay at home for longer because your vitals were tracked. And if you did need to get more care in to prevent a hospital admission, you could source that care as well. And the GP could see you on your phone in your house, and your meds could be delivered to your house. You know, if you can start to cobble together, not cobble, but if you can start to align these health and care techs solutions together, then you get something that's really valuable and could change the way that we live and improve our health for many years to come. You know, no doubt that is why Legal in General, as an example, have invested in both Chris's company and my company, because they can see how they complement each other in time. I don't know if you'd share that view, Chris, but it's certainly something that we see. We see tons of point solutions for health and care when it comes to tech, but we're yet to see a completely different journey for people when it comes to their latter years in care.
I think that's right. And I think we more broadly see that. So COVID-19, in my view, is accelerating a societal shift that was going to happen anyway. Like, in my view, there will be positive consequences of this disease. You know, for one, I think it will fundamentally change how health systems deliver care, and I think it will achieve or push or accelerate the journey to what Andrew's describing, which I completely agree is exactly where things are going to go. And partly that will be a financially driven thing. You know, in the UK, as Andrew said, you know, there will be a lot less money after this, but in the United States right now, the health system, it's a cataclysm financially, because most health systems generate their revenue from elective procedures, and none of them are doing elective procedures. And, you know, some of our client groups are furloughing 50, 60, 70% of their headcount. I mean, it's never happened in history. So from a financial standpoint, they're then having to think, how are we going to be able to operate longer term with a lot less money than we had before, and set up new revenue streams? And they see home-based care as a new revenue stream. I think Andrew's exactly right, though. Like, technology is 25% of the puzzle. It's the kind of connection. It's about more fundamentally redesigning the entire healthcare pathway to no longer be this idea of you go into hospital once you're sick and you leave, and then you come back again when you get sick again, and we repeat this journey until they end up in a care home and then they die. And that's, you know, basically the story of British and American healthcare right now.
Such a brilliant point from both, and I think it's absolutely fascinating. Hopefully the audio's not going too much there. You're actually right to touch on that point. What is happening now, and I completely agree, is this real acceleration of technology and a lot of trends that were happening before. And the kind of wider economics is really interesting, isn't it? It's a bit of a paradox to a certain extent, where these solutions that we need, of course, both of your companies are great examples, but obviously on the flip side, there's much less money available. One topic I was keen to come back to, and I guess there is a huge, of course, hugely different situation now when it comes to raising capital. And obviously we do have COVID-19 as a massive influence currently, but I'm wondering, based on your experiences of raising Series A as well, the last couple of years, are there any principles that still remain the same when it comes to raising, and what should founders look out for as best practice? And I'll come back to you, Chris, to start.
Yeah, I don't think the principles change. I think the principles probably get harder. I think it depends on what market you're raising in, exactly what principles are applied, let's say. But for the UK market, I think that there is, and we actually saw this at our Series A last year. I don't think that this is specifically even pre-COVID-19, there was a lot of chat in the financial markets about the fact we were expecting some other global event. I'm trying to avoid using the word recession. It seems like this is the global event that will break the camel's back, as it were. So we had already seen that there was a greater focus on sustainability, on controlling burn rate, on investing more sustainably in terms of cost base, and a greater focus on profitability in the long run than I think potentially would have been the case a couple of years ago. I think UK investors in general are more conservative than their American brethren, although I think the Americans are shifting their view as well, and becoming more conservative and less let's spend as fast as we can possibly spend and kind of bugger the consequences because we'll raise another mega round in 12 months anyway. I personally see at the moment a lot more focus on what are gross margins, when is the break-even point, what is the burn rate of the company, and is that manageable and sustainable? Is the company adequately managing its cash? And 12 months ago, some of these things would probably been a little bit anathema and uncool to discuss as a startup, and now we're seeing it even with very significant American VCs. We now see these conversations happening where it's a discussion about where your burn rate is and why are you spending what you're spending.
Yeah, I mean, I think what's happening with VCs at the moment is one, they don't know what to keep doing because nobody knows how long this is going for. I think if you've got a product that's flying because of this, you'll still be able to raise money, but they'll be looking for more revenue, more traction, etc. But one of the reasons why VCs will, I mean, the number of deals this year will come down dramatically. Some of the reasons for that are because they'll be conserving cash for their existing companies that they've invested in, and they'll be thinking about how am I going to do extensions for these companies, or I might need to be there in a more significant way for their next round than I was planning on being. So a lot of what I'm seeing is them conserving cash that they would otherwise invest in startups because their existing portfolio is struggling. And I think it'll be interesting to see what VCs do and don't manage to raise another fund, because again, the LPs, the money behind these VCs, will be looking at how did their bets play out in the last fund. Did they are they working? Did anyone exit or not? So I think overall what that means is that it's going to be tougher, but I would still say that your best chance of increasing your odds of getting investment or a Series A is still to park Scotland, go to London, and then go to Silicon Valley and try and get investors from those two epicenters investing. Because again, the multiples, the number of investors, the appetite for risk, it is a different world in London and Silicon Valley to Scotland, in my experience.
Yeah, I also so I completely agree with what Andrew said. I also think people should, raising money becomes infinitely easier the more revenue you have. Like, just the fundamental principles do apply no matter what. The more revenue you have and the more growth you have, the easier it is to raise money. I think too many people see raising money as success, and I would like to kind of completely destroy that notion. Like, raising money is a real bollock. Like, it's really hard. It takes a hell of a lot of time. Most of the time it feels fairly value destroying and like you're not doing anything particularly useful. So I wouldn't necessarily call out raising investment as being the be all and end all of success. And Notion is a specific example. Notion's like one of the many kind of internal collaboration tools that's currently the cool thing of the moment. But Notion basically refused to raise money for ages, and then they've just raised a $50 million round from Index at something like a $2 billion valuation. Notion was able to do that because they basically held off raising for a long time, had lots and lots of revenue and lots of growth, and created so much desire in the market for them that they were able to raise within like a very short space of time of starting it, if you believe the press reports. I just think too many startups see raising money as success, and I think raising money should be a means to an end, it's not success. Like it's really not.
Yeah, and it comes with a big chain around your neck, because now you need to deliver exponential growth and returns in a short time frame. And so, if you're still figuring out your company or your product or how to scale, it can be a bit dangerous. I mean, our own experience is, we did a $500,000 seed round, and then effectively 11 months later, we completed on a $8.5 million Series A. Well, we're still figuring stuff out. So, if you get offered the money, it's hard to say no. And, I think we made the right decision to take it. However, we made some errors in the last year that had we not raised that amount of money, we wouldn't have made, because we'd have given ourselves more time to think about and embed the culture, to understand more about our customers, to not have to deal with some issues and problems that come when you get bigger. We could have saved those problems till later on and focused more time on customers. So I would agree, money at the right time for the right thing, but in itself, if it's actually risky to take money, because you add inevitably problems that you didn't have before you took it.
I want to say I just really totally agree with that. Like, and I know a couple of really successful startup founders with multi-billion-dollar exits, and each one of them would say, "I wish I'd kept it smaller for longer," and it is exactly how I feel now as well. Like, and I say that just at the start of the call. Obviously, I said we're hiring another 25 people, which is effectively doubling our headcount. But like, when you're small, you're faster, you have less problems, you are able to do things at a speed that now we can't do. Adding more people equals more communication that's needed and more challenges, and raising money is exactly the same. And if I was to do all this again, I'm not saying we wouldn't raise capital. Like, raising capital meets a very important or fulfills a very important need depending on your stage, but I would raise it much later than we did in this company.
Yeah. We should talk more, Chris. Save ourselves a few headaches.
Oh, that's brilliant. I know. I feel like I should put myself on mute, and I'll sit back and let you guys chat. But it's such that's a brilliant message, actually. And I think that, when it comes down to it, it's like what you said, Chris. I think this is really important, especially now. I remember in one of the interviews, one of the takeaways from one of the chats we had a few months ago, I think it was from, I forget who it is now. CEO of Float, whose name I've forgotten because I'm just completely mental blank.
Colin Hewitt.
Yes, Colin Hewitt. Completely mental blank. Colin made such a great point, and for some reason I remember this so clearly. He was basically speaking about raising money, and he said, and it's such a simple point, but I think it just ties it all together really nicely. Where it's in a newspaper about it, you never see, startup gets X amount of revenue and has success in another area. It's always in the big bold letters, startup raises X amount. I think exactly what you both said. It's a really great message that, you know, success is not just based on how much money you're raising, and there's so much more to it. And I think that's a great point actually to end from my questions. We've actually had some brilliant questions that I've seen from some Slido. So we'll pass them quickly over to Nick to chair the Slido Q&A. But a very quick thank you from me, first of all, to you, Andy and Chris, and especially in such a, I'm sure, chaotic is probably an understatement, chaotic time for you both, and really appreciate the insight, and it's been genuinely a fascinating conversation. So thank you both, and I'm sure the audience will appreciate some questions from them as well, and I'll pass over to Nick.
That's great. Thank you very much, Christopher and Andrew. So I'm going to ask some anonymous questions that have come through, but we've got some questions from our audience here tonight. So I'd like to go live to Lisa to ask a question.
Hi there, thank you. I just want to say that this conversation has been immensely valuable. Thank you, Andrew and Chris, especially the co-founder info, because I'm looking for one. So, and I will just say, you talked about America being so competitive, and Scotland may be smaller perhaps, but it is more collaborative and open. In the US, you're afraid of people stealing your idea. So it's great to be here. Affecting the public health is falling to the private sector as well as the public sector. And you touched on what it was like to work with all these trusts and authorities and how there's a lot of red tape. But what I'd love to hear from both of you right now is how currently are your companies working with the public sector? Are you working in any official capacity, collaboratively, partnership with the NHS or any other public sector org?
Do you want to go first, Chris?
Yeah, sure. Yeah, we have about 20 NHS clients across the UK, and we support them across inpatient work, so specifically helping them extend the capacity of their hospital wards and reduce exposure of their staff teams. Because right now, depending on the exact hospital, they will try and maintain COVID-19 patients within side rooms until it's impractical to do so. But every time someone goes into that room, they have to effectively use 2 full sets of PPE each, which means they burn through it very quickly. And if we can reduce the number of times they have to visit that room by having the patient continuously monitored, then we can reduce exposure and reduce PPE turnover. The second one, which is more core to our long-term interest, is supporting the early discharge program. So patients who are either high risk to the disease but are negative, so say like cancer patients, for example, or who are positive but considered low risk. About 80% of people with COVID largely have mild disease, so those patients can be managed at home. The problem is that between day 7 and day 10, a seemingly random proportion of patients suddenly develop severe disease and need to be admitted, and it's entirely unclear who those are. So if we monitor them, we can identify who has severe disease, and then we can get them into hospital earlier or not have to admit them because they haven't. And then the last one, which is becoming a more growing use case for us, has been within care homes, and specifically that's in the area again of trying to reduce exposure to staff and keep elderly patients better monitored to understand if they're going to get worse. And right now we do this across the UK.
Yeah, and for ourselves, we signed a contract about 4 weeks ago with 9 CCGs in London. And what we're doing specifically with them is they're care brokers. So these are council workers responsible for finding people a home care service. Those brokers, are using our website to understand available capacity in the market, connect with those providers, and find care quicker than they would otherwise, which would be going down a list and phoning everybody. And the other thing we're doing is we've captured a lot of data during COVID-19 around where providers have got capacity and where they don't, and also where providers are struggling because of a lack of staff. And we're providing that data in various different formats to bodies such as NHS Digital, and to some provider organisations as well, like the UKHCA, to try and support them with their response to COVID-19.
Thank you.
Excellent, gentlemen. So we'll just head over to David D. David, are you ready to ask your question to the guys?
Yeah, sure. So I'd echo Liza's thank you. It's really interesting chat and some really interesting viewpoints there. My question is more for Andrew. And we've talked about investor appetite in your companies. I think big institutional investors and funds see the care sector as a lucrative opportunity for them. Is that one of the problems that you mentioned with the industry? And is that something that CareSourcer can help address?
By lucrative, do you mean they think they'll get good returns from making investments in tech companies focused on care and health, or?
It's less on tech companies, more on residential care,
Okay.
but also care companies in that sort of industry.
Yeah, okay. So private equity is quite big in care, in particular care homes and hedge funds as well. If you've read anything about Four Seasons, it got a really negative perception in the care sector because over a period of 20 years, they've stripped away the property from the operating care company, and that's made it more vulnerable. There are some returns to be made if you want to invest in care companies and care homes. Our data as a marketplace where we can surface supply and demand and prices can help investors looking to acquire or not acquire a particular care company as to some of the data that might help them make that decision. So for instance, we could say to an investor, this would be a good company to acquire or not based on the supply and demand and price dynamics in that local market. So we can help investors in that way. I'm not sure if that's what you're getting at specifically, but the data that we generate can help determine where the next 100 care homes should be built, basically.
That's really interesting around supply and demand. I wasn't thinking more around you helping the investors, but more the care homes and the people looking for care finding solutions themselves. But obviously the data can help them both.
Yeah, so I mean that's equally a good point. So for instance, we could surface products and services to people looking for care that might prolong their independence at the need to admit to their care home. That's something that we're thinking about our product roadmap. With providers, the best way to help them is to ensure that they have access to not just local authority funded residents, but also self-funded, because the self-funded residents deliver a 5x profit for that care provider. So they are critical to the sustainability of those providers, because when a provider takes on a client from a local authority, it's loss-making.
That's really interesting. Thank you.
Okay, so to keep things nice and balanced, we're going to come to Araminta for a question for Christopher.
Hi, Christopher and Andrew. Thank you very much for the chat. So, I'm at the beach at the moment. So my question is for Christopher, but I think Andrew could also kind of can apply to your business too, and it's about health insurance. So what is the role of health insurance companies in both of your companies? And Christopher, how exactly do you think that maybe you could sell your product to health insurance companies and they could take on that role to distribute it? Because I personally work in fintech and I love insurance technology. It's also part of that kind of new startup world where we're trying to improve, like fix problems with technology, but more quickly, because insurance companies are also incumbents that are taking ages to move. quickly. So yeah, basically, what is the role for insurance companies and maybe insurtechs too? I'd be curious to hear.
So I think it's different between the US and UK. In the UK, we obviously have a single payer system, and that system, in my view, creates better alignment between the providers of healthcare and the community healthcare interest. And by that I mean it's, with a few exceptions, fundamentally in the interest of the NHS Trust, the Health Board, the CCG, and ultimately government to better deliver care and improve patient outcomes, because ultimately the best way of making healthcare cheaper is to make a healthier population. The United States, the landscape is obviously considerably more complicated because they don't have a single payer system. They have, multiple payers, and by payer I just mean insurance company, and that makes it much more complicated, and the incentives are not always the same. And to give a specific example of that, in the United States for a long time, and to a certain extent still today, there wasn't much of a focus on preventive care, because most people receive their insurance through their employer. Most people only stay with their employer for about 2 years, and therefore by the time that you reach a point of genuine sickness and cost, you are someone else's problem from a financial standpoint, which is an awful thing to say, but pragmatically true. What is now happening in the United States, which I think is really interesting, and it's true in both the Obama administration and the Trump administration, is that there is a greater focus on what is called value-based care, which is something that is part and parcel of how care is delivered in the UK now. It could be called payment by results. And effectively, insurance companies are shifting more of the insurance risk onto the hands of the healthcare provider themselves, and either penalising them for poor quality care, or penalising them because a patient readmits, or giving them complete exposure to the care of the community. There's a hospital in Dallas that we work with who has what's called the capitated model. Effectively, they get a payment per member of the population within their community, and they have to deliver care to that whole community. And the idea is it incentivizes that hospital to deliver much more preventive care. And sometimes that works and sometimes it doesn't. But what we do see as a company is, in the United States, we're doing a lot more work with the insurance companies, because we can effectively take 5, 10, 15,000 patients who are at highest risk and ergo highest cost, continuously and passively monitor their health, and then surface who is it that requires some intervention, and then link them up with someone who can actually deliver that intervention and hopefully improve their long-term outcome and reduce the overall cost of delivering care to that individual. And that's something that we are starting to do with both insurance companies and employers in the United States. We see right now much less of a role for that in the UK because of the kind of structural differences between the two markets.
I can maybe talk briefly to the UK. So obviously we're both backed by a large insurer, Legal & General. One of the things that we think is going to happen, and again, COVID might accelerate it, is that in the not too distant future, much like you are required to contribute through your working life to your pension through a salary deduction, we think that the same thing will happen for your future care costs. So you'll make a contribution, your employer will have to make a contribution, and that will be an insurance-backed scheme. And so aligning ourselves with an insurer means that when more and more people have to fund their own care in the future, then we'll be well placed to deliver that.
Excellent. So we're going to go over to Jude, who's got a burning question there. Just unmute. Jude, how are you doing tonight?
Hi, I'm good, thanks. I'm actually really enjoying this chat. I don't know if Chris and Andrew remember, but I met you both when I worked at Scottish Edge many, many years ago. And it's really nice to see how far both companies have come on. And I also love how in agreement you are with each other. Obviously a lot of harmony in the health tech community in Scotland, which is nice. My question for you is, it's probably more aimed at Chris, but Andrew, I would love your opinion on this. I have a couple of chronic health conditions, and an issue I find is that when I go and see my specialist, they only take me at kind of face value and what they're seeing that day, because what I'm telling them has happened in the 3, 6, 9 months between my appointments, they can't put fact on. They're only taking it at face value, and I could be lying, or my conditions can cause a lot of insecurity. They're visually appealing, and they, as well as physical. So it could be emotionally influencing my story. I just wondered how you think, Chris, in particular, your technology could help with that. But also, Andrew, do you think that with the way you're shaking up the care system, could you shake up how we're dealing with chronic illnesses?
I'll let Chris go first.
So, I think that's what you're experiencing is that fundamentally all health systems are really bad at managing chronic disease. The UK is, in my view, better than the US is at it, but it's still pretty bad.
Yeah.
And partly that's a function of volume, just managing the influx of acute disease, and partly it's structural. The hospital system, the system is very structured around hospitals. Specialty physicians are situated within hospitals, and they tend to get overburdened, in my view, with acute care. And one of the things that's really challenging is to have a conversation about the fact that we'll never get past that unless we fundamentally re-architect the system, because you'll just constantly have this burden of acute care that you have to deliver, and you'll never fix it unless you start treating things much, much earlier. And partly that's why I was talking a wee bit in the United States in my last answer about working more with insurance companies and taking populations who are at risk of suffering acute bouts of a chronic disease, or at risk of suffering chronic deterioration over time, and trying to surface who in that needs intervention at a much earlier point than would otherwise be possible. So instead of, it's a little bit contrived, but I would much rather a world where we could flag to your physician that now is the time that you require treatment, and it's all based on objective data to say, you actually need this. And I think that we're getting to that place. It's just, it's a fundamental restructure of the way that our entire society delivers healthcare.
Definitely, and I think that's what I was getting at. Sorry to just jump in with a follow-up, is that the conditions that I have is psoriasis and psoriatic arthritis. Now, both of them come from the same place, but my dermatologist won't talk to my rheumatologist, and my rheumatologist has put me on a medication, and because my rheumatologist has put me on that medication, my dermatologist won't give me everything, and it's a vicious cycle. Do you think that your technology could actually bridge that gap?
So I don't think technology is the answer. I think that it can be a part of the solution, but I think it requires a more fundamental rethink of how healthcare is being delivered. And I appreciate that's quite a fluffy answer, but what I mean by that is that more and more health systems are trying to look at patients like you, or individuals like you, who require recurrent care, and understand how can they deliver a more joined up healthcare experience. And we can be the way that is joined up, if you like, but it does require the health system to be willing to join it up in the first place. And that part is the really, really hard part. Technology is the easy part in all of this. The hard part is you have to get to the point where the health system is willing to link the rheumatologist up with the dermatologist, and they have some process of reviewing that jointly. I mean, the probability is your rheumatologist and dermatologist have never met, you know, or if they have met, it's, you know, to review 50 other patients, and that's probably on the acute ward round, not on the, you know, not about people who are out in the community. There's also, despite what I said, there are still some poor incentives, like in England and to a certain extent in Scotland. The NHS trust is not, it's not necessarily being paid in some cases for that care either, which creates a kind of perverse incentive to care more for the acute side than the chronic side.
Mm-hmm.
Yeah, I mean, you're coming up against the system. You're fighting the system, which is crazy. They should, you know, the system should be supporting you, but you're coming up against a system that was the biggest users of fax machines only a year ago or something in the UK. So it's behind. The systems don't talk to each other. I think, unfortunately, before the system changes, you'll probably be able to go onto an app, take a photo, if that's the way to provide information, and machine learning in the cloud will tell you, and you have a pharmacy delivered with medication, and you might not even touch the health system, because private sector will move, I think, ahead of run health systems. However, there are some little companies that are trying to join things up without waiting for the system to do it themselves. There's one called Patients Know Best.
Yes.
I've never actually been on it, but I think the premise is, rather than you having to retell your story to 4 or 5 or 6 different people that you come into contact with, you know, your GP, your dermatologist, whatever, then actually this single patient record travels through the system or atop the system. And maybe that's something that would help.
Yeah, I actually met them. I used to work for, I did a project work for Cohesion Medical based in Glasgow, and at an event met the company you're talking about, and was devastated when they said they weren't in Scotland, because every time I meet a new clinician, I have to go through my story, and I've been on that much medication that I don't know all the names, so that would be really easy. Sorry, Nick, I realise I've taken over a little bit here.
Not at all. This is important stuff. You know, now more than ever, communication and joining the dots is key, not to waste people's time and to keep hospital visits short. So great question, Jude, thanks. I'll take a question from one of the anonymous submissions that we got through the week. So it says, in spite of the fundraising scene changing dramatically, what principles are even more important than ever for attracting investors? And maybe we'll go to Christopher first for that one.
Yeah, I mean, I think it's what we said before. Like the principles don't change. I think they'll just more harshly apply depending on the circumstance. You know, I think ultimately the easiest way to raise money is to generate as much revenue as you can and keep growing that. And if you can show it's sustainable and profitable, then even better. And as for what the metrics are right now, I think it's too early to say. I know multiple companies who've had term sheets pulled, who've had their valuations reduced. Equally, I know companies who are raising mega rounds and they're doing really well. So I think it's way too early to understand what the dynamic will be.
Yeah, I mean, just specifically on principles, you know, the things that I would still call out would be, you've got to have a big picture, big outcome for the investors. Otherwise, it's a non-starter. You've got to be solving a problem. You've got to have an amazing founding team. You've got to be really clear about what you're going to use the money for and what milestone it's going to get you for the next round, if that's the journey that you're going on. And again, you've got to have some element or some way of getting to an unassailable position. So what is the thing that you're building that's going to set you apart from other people that might come and copy you?
That's interesting. So penultimate question, we're going to go to Johnny. I'm just trying and unmute him. There you are. Are you there, Johnny?
Yep, I'm here. Thanks very much, guys, for this event. I could probably get into trouble for saying I'm going to say I'm going to share. Anyway, it's the reason everyone's been saying it. I've really enjoyed this one. Obviously done quite a few of these events now, and this is certainly right up there with my very favorite. So cheers. My question for each of you is, having now embarked on several stages of the journey, still stage to go, what are some of the things you wish you knew towards the start? You mentioned a little bit about raising venture capital, about dealing with regulators. What are some things you would do different, and what are some of the things you would wish you were more prepared for going into it?
So me and my co-founder were both non-technical co-founders, meaning we didn't have experience of technology or coding. That's been challenging for us at times. So I would, if you have the option of starting a business or thinking about a co-founder and it's a technology business, I'd be looking for a co-founder that was a CTO. I think that one of the other lessons for us, and this is going to sound really big-headed, and I genuinely don't mean it to, was that we gave too much control and too much autonomy to people too quickly as we grew. We sort of embraced the concept of agency and making people autonomous and giving them decision making, and that's how we would get the best motivation and output and outcome. And the truth is, we let some people down because they needed more direction from us as founders in the early part of that journey, because guess what? We were the only ones that had worked in care for 10 years prior. We were the only ones that had dreamt about this for countless hours before they'd started. They may be new to startup, or they may be new to care. And I think that had we been far more directive at the start, then we would have helped a lot of people get up to speed much quicker, and that was a big learning. And I think the last thing for me when I think back was, there are so many brilliant people that might join your company along this journey and have so many experiences, or maybe join your board that have so many great experiences. Nobody knows your business better than you do, and I think sometimes you can lose track of that, and you've got to be really strong-willed. You've got to be able to listen, of course, but then apply what you're being told and the direction you're being given to your own situation, and really think hard about whether that advice is good or not, or whether you should stick to your guns and carry on. And so, yeah, in summary, it would be give more direction at the start, trust your own instincts more, and if you're a non-technical co-founder, make sure you've got somebody exceptional either as a co-founder or in the founding team that can be there every step of the way.
Thanks very much. And yeah, Chris, yourself?
Yeah, so
I'm going to start writing your stuff down, but sorry, go on.
I agree as well. I mean, I think what I said before, I would try and keep it small for as long as possible and establish as many. Yeah, I've met quite a few software company founders who they want to come and talk to me about raising money, and some of them in some cases have got products that have some revenue. They've got a growing funnel, and they don't necessarily have an obstacle to growth at that particular point, but they want to raise money, and it's kind of like, why? Like, is there a reason why you can't close the funnel that you've got before you raise the money? Because you'll increase your valuation before you do it, and don't raise money unless you have to. And so I definitely would want to keep it smaller. I agree with what Andrew said about trusting your own instincts, and specifically, be very, very, very careful with advice, because advice comes from a particular context and worldview, and it's often radically different to the one that you're in. And ironically, I'm saying this as I'm giving advice, but the startup world is full of people giving advice. Like, Twitter is the worst thing in the world, because it's just a group of people giving advice, usually VCs and usually people who've never started companies. And for me, like, a good example, and actually Andrew touched on this, is this whole idea of giving agency and autonomy, and definitely, like, we try and build up our teams to make decisions and to be autonomous. But see, at the same time, people would say, don't be a control freak. I can quite honestly say right now, if I hadn't been a control freak about some decisions, it would have been a disaster. And in every occasion where people have said, you know, you need to back off and let more of your team make decisions, like, fundamentally, yeah, that's good advice. But at the same time, there is absolutely a need sometimes for someone to just be a complete control freak about pedantically getting it right. And it's completely counterintuitive advice, but I have found it to usually be the case. The other thing I would do more is be just really super persistent with questioning, like, until you get to the answer that you want. And if something smells wrong, it usually is wrong. I've also found great merit in being the stupid one in the room and asking the stupidest question in the room. Like, that there is real value of asking the stupid question, and quite often people haven't thought of the stupid question. So I like being the kind of idiot in the room and always asking the dumb question. And it's remarkable how many times that stupid question hasn't been thought of and actually helps. The thing that I would do sooner, and this is slightly conflicting with the other advice that I gave, but it's all because it's shades of grey, is try and build a good team around you at the right moment, but be aggressive about it when it is the right moment. You know, over the last 6 months, I've put a lot of time into building an executive team around me, and I would not be alive right now if it had not been for that team, particularly with the growth spot that we've just went through. And you know, we're building out that team further right now, and it's not just about the exec team, but it's about the broader team. Finding people who are, it's one thing to find good people. What is fundamentally hard to find is people who will own problems and solve problems and actually fundamentally own it. It's really easy to find people who are good at taking a direction and implementing it. And it's really easy to find people who shout about problems and why everything is shit. It is actually really, really hard to find people who are really good at just taking a problem on and delivering and solving that problem. And when you find those people, you should, like, surround them with love and never let them leave. It wasn't a value that I selected for enough earlier in our hiring, and it's now a big part of our hiring. And then the last thing is just, like, to a certain extent, stop listening to advice. Like, Twitter for me, I find to be almost it has almost a negative mental health impact, because you read all these stories about other founders who are raising like, you know, 200 million and who are doing this and doing that, and it sounds amazing. And the thing that I've learned more than anything is it's never the whole story. Like, it's never the whole story. It's when I came on here and I talked about the fact that we're growing hugely, we are hiring another 25 people. You know, that sounds great. Right now, operationally, our company is a complete shit show on a daily basis. Like, we have so many problems. It's complete chaos. And none of that's, like, public until now, and none of that's known. But if we had 2 Wall Street Journal articles written about us a couple of weeks ago, and it sounds awesome. But none of those articles would talk about the operational shit that's going on in the background that could, wipe us out on a daily basis. So stop listening to all of the media and the advice that's out there, and take it all with a huge pinch of salt.
Yeah, really, like, with that, really appreciate the kind of honesty as well. It's what we hope to get across more, and I really appreciate sharing, because it's very easy to see the outward perception on social media of companies and just the people, and think that that's, you can't compare your normal day to everyone else's perfect world where they appear in publication. Yeah, really appreciate it.
Johnny, it's just fake it till you make it, honestly. we had this company that started around the same time as us in London, and they suddenly came out with a 70 million raise, and we were going, how is that even possible? Mm-hmm. Now, it's not. They've raised about 10% of that, which is great. But the rest of it is debt financing that they can only get their hands on if they meet certain targets. So, it's so difficult, right? Because you're, as a founder, you're by yourself a lot. You're holding all the problems into yourself and shielding people in your company from it. You're constantly trying to make sure that you are putting your best foot forward with investors, prospective and existing. And I agree, it can do you some damage if you believe everything that you read around, companies and people that are succeeding. It's never as rosy as it looks. Definitely not.
Mm-hmm. Yeah, completely agree. Thank you. Thanks for sharing.
So, Christopher, I'm glad that you mentioned that you're a control freak, because so am I, and I'm going to take the last question myself.
Dictator Nick
Classic.
Data.
I'm just going to mute Johnny because I've got that power as well. In the interest of leaving us all with some blue sky thinking, in one sentence each, this is the challenge. What positives do you guys think you can take as purpose-driven, human-centric businesses into the new normal? And whoever's bravest can go first.
I'm happy to go. I absolutely think there is more opportunity now than there has ever been if you are cautious in your thinking and aggressive in how you're applying that. Like, there is a huge amount of opportunity at the moment to do societal good, to create really valuable businesses and build really meaningful companies. So despite everything, I personally think it's still an amazing time to start businesses and solve problems.
Yeah, and for me, bringing it back to an individual perspective, if you've, in the course of your company so far, helped one person, learned one thing, you've got something already, and don't devalue that. It's not always about business success and growth. You can definitely take value from the journey that you're on. It's not all about tomorrow.
Nice. Good stuff. Thanks for rising to the challenge there, guys. Declan?
Fantastic. And thank you, guys. It's always brilliant to end on such a positive note. And speaking of notes, I'm not physically been able to write anything down, but I've taken a huge amount away myself. And thank you both, Christopher and Andy, once again. And, like you were saying, Christopher, I can only imagine, how much of a shit show things may be in these mad times. And thank you, everyone, for joining us as well. It's been an absolute pleasure as ever to still come together and connect and support each other as a community in these, to use the cliche for the 20th time, unprecedented times. And thank you again to our partners as ever. We are actually delighted to have been sponsored by AWS for this month. We do still have the opportunity to apply for the mentorship program. And if I have a couple of hands free, I'm just going to link this in the Zoom chat. If anybody is interested, it's an absolutely superb opportunity. Some real experts in many areas of running a startup, from marketing to product and everything in between. Thank you again to our other partners, of course, CMS, who have been brilliant sponsors for the wider Scotland community, of course, supporting the Glasgow chapter too. They've also got many superb opportunities as part of the Equip program. And thank you again to Alan from Custom Flavor. Again, make sure to check him out. He has been a true supporter of Startup Grind over the past few months, and we are forever in his debt. And thank you, of course, to Future Simple, who have been great partners from a marketing point of view. And one thing I'll be sending to Christopher and Andrew is a Social Stories Club ethical gift box. And coming back to the point of purpose, just as a thank you to you both for joining us, it's a nice message that we can all share. So thank you again to you, I should say rather, and back again to Nick to share some news on upcoming events.
Indeed. So next Thursday, the lovely team at Startup Glasgow are hosting Mr. Barrington Reeves to talk about effective branding in unprecedented times. I think we need to ban that word unprecedented. It's really just
seconded
on my soul.
He started using it before it was overused.
Okay. So he's the creative director of Two Galas, a design agency in Glasgow. And then I'm thrilled to be interviewing Mr. Gavin Oates, author, international speaker and entrepreneur on the 14th of May to discuss inspiration through, or motivation through inspiration, but could easily be inspiration through motivation. So I'm listening to his book at the moment. It is called Life Will See You Now. It is amazing. It is an absolute tonic for these times. So hoping you guys can join us there as well.